Good afternoon, one and all. My study topic is retinal changes in schizophrenia, a study using spectral domain optical coherence tomography. Schizophrenia is a devastating and complex disease carrying a lifetime morbid risk of 0.7%. It's a neurovascular, developmental, and degenerative disease. It's chronic and relapsing with generally incomplete remissions. It's among the top 10 leading cause of disease-related disability in the world. Neuroimaging studies have found evidence of significant and progressive reduction in the total brain volume in schizophrenic patients compared to age-matched controls. Neural excitotoxicity due to excess of glutamate was suggested to contribute to the neurodegenerative process of schizophrenia. Photoreceptor, bipolar, and ganglion cells release glutamate as their neurotransmitter, and multiple glutamate receptors have been identified in the retina. OCT has been used to assess RNFL thickness in several neurological diseases such as in multiple sclerosis, Alzheimer's disease, and Parkinson's disease. The retina is a good model for study of all these neurodegenerative diseases since it lacks myelin. Any changes in the RNFL will reflect axonal damage, thus providing us a window to the brain. It still remains to be confirmed if excessive glutamate causes any structural damage to the optic nerve and retinal layers in schizophrenic patients, thus explaining the visual processing deficits observed in these patients. Evaluation of structural RNFL with OCT may establish tissue loss, which can explain the abnormalities mentioned above. Aim of our study was to compare the peripapillary RNFL thickness and macular thickness in schizophrenia patients with normal control population and to evaluate these changes based on the duration of the disease. We did a comparative cross-sectional study in the Department of Ophthalmology and Department of Psychiatry in a tertiary care center, and the sample size was 20 in each test and control group. Group A was patients diagnosed with schizophrenia spectrum disease based on DSM-5 criteria, and it was further divided into short and long duration disease with 2 years as cutoff. Other inclusion criteria for group A and B was best corrected visual acuity more than 636 and in the age between 18 to 65 years with normal intraocular pressure and good OCT signal strength. We excluded all the patients with neuropathies where there will be a change in RNFL thickness like macular degeneration, glaucoma, history of ocular or intracranial diseases and congenital abnormalities of optic disc, history of cerebrovascular accidents with residual paralysis, other neurodegenerative diseases and systemic diseases such as diabetes. We divided the study subject into group A and B. Detailed history and examination was done, followed by OCT RNFL and OCT macula, and analysis was done. Out of the total schizophrenia patients, 70% were male with a mean age of 34 years. In comparison of peripapillary RNFL thickness showed statistically significant reduction in the thickness, but not in the inferior quadrant. In rest all quadrants, there was statistically significant thinning. But in macular thickness analysis showed statistically significant thinning only in the outer superior and outer inferior quadrants, even though thinning was present in all other quadrants too. In comparison, according to the chronicity of illness, showed a reverse correlation of the peripapillary RNFL thickness with the duration of the disease. These are the OCT images showing thinning in PRNFL and macula. OCT evaluation of structural RNFL loss will be useful to determine if there is any RNFL thickening which may contribute to the deficit in the visual perception and processing. In this comparative cross-sectional study, the peripapillary RNFL thickness was shown to be significantly thinner in schizophrenic patients compared to normal population. This correlated with the previous neuroimaging studies that showed gray matter volume reduction in schizophrenic patients compared to healthy controls. Findings of this study also support the evidence that schizophrenia is a progressive neurodegenerative disease and that this degeneration is widespread and it's measurable in the retina. VV in a study also concluded that RNFL, macular thickness and macular volume measurements are reduced in schizophrenic patients and the degree of thinning correlated with the duration of illness. Also, Mehdi Azad also found that disease duration and RNFL thickness were linearly associated, though it in opposite direction depending on the chronic or acute state. Limitation of my study was small sample size, which might have attributed to the statistical insignificance of certain parameters. A long duration study with follow-up OCT scans would have given a more reliable results and better correlation with chronicity of disease. To conclude, schizophrenia caused peripapillary retinal nerve fiber layer thinning, and the degree of thinning correlated with the duration of disease. Therefore, SDOCT can be a useful tool for the disease diagnosis and to monitor the progression of the disease. These are my references. Thank you.
Thank you.